afternoon. My name is Jessica. I'm a certified physical therapist assistant. I'll be working with you today. Is that okay?
Yep.
Can you confirm your name and date of birth?
Jennifer Seaver, May 5th, 94.
Okay, and how are you feeling today, Jen?
Good.
Good, yeah. Are you having any pain, soreness, aches?
No, not really, not today.
Good. Okay, so I read your plan of care with my supervising PT. It looks like I'm gonna do some passive and active range, testing your strength of some muscles, as well as taking some measurements. Then, okay? Now I will be performing passive range of motion for knee extension. My patient is positioned supine, and I am stabilizing her femur and the distal end of her tibia and fibula. So I'm going to gently be passively moving her knee into extension for 10 repetitions. Now I will be instructing my patient to actively perform that same movement of knee extension for 10 more repetitions. Now I will be performing the goniometer movement or measurement for left knee extension. So you're going to place a towel underneath their left calcaneus in order to elevate the lower extremity. My stationary arm is lateral midline of femur toward the greater trochanter. My fulcrum is the lateral epicondyle of the femur. My moving arm is the lateral midline of fibula toward the lateral malleolus. Normative values are 0 to 10, and my patient started at 0 degrees, and I was able to get her into 1 degree of hyperextension, and my end feel is firm for this. General gross assessment for knee extension. This gives me a 3 out of 5, and then resistance applied into knee flexion with max resistance, 5 out of 5. Now I will be doing the MMT for the semimembranosus and semimembranosus. So the patient will be prone with her hip in internal rotation. So the patient's able to do that movement against gravity without resistance for a 3 out of 5. Then I am applying my direction of force into knee extension and stabilizing her contralateral hip to get a 5 out of 5. Now I'll be doing the MMT for the flexor hallucis longus. My patient is supine, and then instructing her to just flex that big toe, which gives me a 3 out of 5. Then I'm going to stabilize her metatarsal joint, and then I'm going to be applying resistance of the distal phalanx into extension, and that gives me a 5 out of 5 for max resistance. I will be assessing the muscle link of the soleus in a standing position. So you're going to have the tested limb in slight hip extension, 30 to 40 degrees of knee flexion with the heel flat on the floor. I'm going to instruct my patient to shift her weight forward onto the opposite limb until that tested heel is about to come off the floor. So then now I'm going to take the dorsiflexion measurement of that left ankle, which gives me 15 degrees. And then you're going to assess the other side as well. So you're going to instruct the patient to switch sides. And then again, making sure that tested limb has slight hip extension, 30 to 40 degrees of knee flexion. And then instructing the patient to shift forward onto the opposite limb until the tested heel is about to come off the floor. And again, you're going to take that goniometer measurement of ankle dorsiflexion. And the measurement is 15 degrees as well. Now I will be performing the Homan sign to assess for deep vein thrombosis. Patient will be seated. You're passively going to lift that lower extremity to 10 degrees and abruptly dorsally flex the foot and squeeze the muscle belly of the gastrocnemius and the soleus. So this is a negative finding. Positive would be indicated by pain or tenderness in the calf.